We've taken your pictures. We're going to take a look at them now. We're going to go through them and find out what things that you are interested in getting treated today and some other suggestions I might have for you. What areas of the face are of concern to you?
Here and around the lips.
Okay.
The crow's feet around the eye, and then the middle of the forehead. Yeah, and maybe some of the lines too along the forehead.
Okay. So for the frown line that you're mentioning here, that's a Botox area. So we're going to put Botox there, and that relaxes the muscle. And so in effect, the job of the muscle is to pull the brows together and down. So when you relax it, it lifts them up and pulls them apart, which gives you a nice open lift.
Does that do anything to your eyelids too? Does it lift those up?
Yes,
Yeah,
because
I like
they're
that.
attached. Yeah, I like that too, right? So yeah, when the brows go up, it takes the lid with it. So it takes some of that laxity that you have here. In addition, we're going to add Botox out here to the lateral portion of the eye, which will help with the crow's feet that you're concerned with, but that will also lift the lid.
But I won't look surprised.
No,
right?
no, not too much. And it's all in the matter of how you do it and how much you put in. So as long as I know what your design aesthetic is to look natural, I'm going to tailor my treatment towards what you want to have happen. We'll also do a little bit on the forehead because you said those horizontal lines bother you a little bit. I don't like to do a whole lot because that is the muscle that keeps the brows up. So the least amount I can put in the forehead and get the best effect, the better brow lift you're going to get, which I think overall is going to add to your appearance of beauty, is just to get those brows up and get the heaviness off the eyelids, because you have such great eyes. They're the most beautiful, clear, crystal blue I've seen. And so you want to be able to see as much as you can of them. And right now they're kind of crowded in by some of that laxity going on around the eyes. So under your eyes is another area that it gives you a little bit of an aged look, a hollow, sort of that dark look under here. I don't know, do you use a lot of concealer under your eyes? Yeah. And some of that is to conceal the darkness, which is caused by a hollow, which happens when we age. We lose a little bit of that tissue under there, some of the fat, some of the bone is actually wasting away. And so to replace some of that volume, it really helps build that back up. So what we do is we go underneath the muscle and lift the muscle up to take the space. So we're not actually putting a whole bunch of filler in here so it looks voluminous. We're lifting that muscle up to take the space that's gone right here. So it's a very natural look, and it's not painful. It sounds horrible to have a needle up by your eye, but it's actually one of the least painful areas to do dermal filler, and that lasts a really long time. So that's a great bang for your buck. You had said you were concerned with some of the perioral or the wrinkles around your mouth, and I think that would be great. We're going to do some dermal filler around there. So I think if we can reshape this area with some dermal filler, that would look great. Coincidentally, your wrinkles will be a lot, smoother, mostly gone. We lose 1% of our collagen a year after the age of 30. So it hits everywhere. But what happens around the mouth is that even in earliest 30s, it starts to sort of target around the mouth, and that's when we see those early lipstick lines. Even in your 30s, you probably notice that. And it just continues to break down from there, and then it starts targeting the actual lip. Even though we're not going to do your lips and give you the fish duck lips or whatever, we will be re-establishing some of that shape that you had in your lips when you were younger, and just by redistributing and rolling out your own natural lips. We use a formula here called decade dosing. So if anyone comes in and they haven't had a lot of work done, we like to sort of give them an idea that after they've lost this volume, that they need at least one syringe per decade to regain that volume. So it's sort of a baseline of what you've lost and how we can replace it to bring you back about a decade ago. So you're looking at about 6 syringes because you're closer to the 60 range. Now, what we can do is do them all at once, which gives you the benefit of just having one downtime, and it's a social downtime. It's not like you can't go out. It's just that you might be a little bit bruised, a little bit red and swollen. Or we can stage it. We can do certain areas that bother you the most and then come back and clean up. What happens though is if we take care of the areas that bother you the most and those are now cleaned up, other areas are going to start to bother you more. And so I recommend trying to get it all done at once. I think it's the most economical because we end up doing multiple syringe discounts after we hit about 3 or 4. We end up discounting if we can do it all at once. But if your budget can't allow you to do that, we can definitely stage it, and you can do 2 or 3 at a time. But I would try and get the entire project done within 6 months or so that you can get the best benefit. And you're going to get a good 18 months to 2 years longevity out of this. And even when you come back at 18 months to 2 years, you're not going to need 6 again. So if you have a particular budget that you're coming in with, it's important for me to know. And then I can start sort of showing you the things that we can do within your budget. Mm-hmm. And then I'll show you the things that we couldn't do outside of your budget. So after that $2,500, let's say, there's 2 syringes here and this is where I would put them. And then you can make that decision. You can come back later, or you can decide at the moment that you decide, what, let's just do it. It's up to you. So we want to do as much as we can to accentuate your most positive attribute, which is your eyes. And by that, we can put in the volume here in the temples, which is just an extension of this cheekbone. Right now, your cheekbone stops right here at the lateral aspect of the eye, and then it goes into a concave. Mm-hmm. And so by volumizing this area, it's going to extend this cheekbone all the way up and give you a nice uplifted look here. And we'll start with that, and then when we do that, it takes up some of the weight and the slack that's going on down here. So if I start here, I'm not going to need as much down here. But definitely we want to address this jowling that you have on the jawline, which is very typical. As we age, that tends to break down the bony structure and leaves some draping, and it ends up being right around the jawline and giving that wavy kind of jawline. So we can redirect that tissue into the mid-cheek where you've lost some volume here, where your fat pad is separated, and you can kind of feel that little line right here that goes from the eye all the way down through the cheek. That line is the separation of the cheek fat pad, or the malar fat pad. And when that separates, part of it falls forward and creates this nasolabial fold, and the other part just ends up being a separation line right here. So by bridging that gap across it, you end up getting a nice lift on this fold, as well as finishing off that cheekbone right up in here. So it's really a nice look, and it gives you that upper third of the face, gives you the volume right here. We really want to keep the triangular shape with the most of the volume up here in the upper part of the face, and then have it taper down into a nice V in the lower face. As we age, that tends to shift, and we end up getting more square on the jawline, and the triangle inverts actually. You've lost a little bit of this volume, and that's what's another thing that's holding up your brow is the bone, the periorbital bone that's around the eye, and that is starting to go. So if I can recreate some of that bone with some dermal filler here and here, you're going to get a nice light reflection off this bony prominence right here on the lateral aspect of your eye. All of this that we've discussed is going to be about 5 syringes, maybe 6. It takes 5 of those syringes to make up 1 teaspoon, so it's really not a whole lot. It seems like a lot, and you've probably seen people on TV that look full, and I don't want you to be concerned that you're going to look full. I don't even like to use the term filler because it's sort of a misnomer. It's not really filling. We're redirecting and restoring. With your Botox, doing the frown line in here and a little bit up in the forehead, definitely want to do the crow's feet. We also would like to do a little bit of a lift on the jawline, the microtox, and maybe the Nefertiti under here, which relaxes the muscle. This muscle is called the platysma, and the job of the muscle is to pull the face down. So in my opinion, it's okay to get rid of that. We can definitely release that muscle and let the rest of the muscles that pull up do their job properly. You're looking between 75 and 100 units of Botox, which is about $1,000. So that's your Botox, and that lasts about 3 to 4 months, and then that needs to be maintained and repeated every 3 to 4 months. The dermal fillers, you're looking at about $3,500 for the dermal fillers, and that will last you a couple of years.
Now, is it true that when you've had this done before, and then when you come back again, usually it'll last longer and longer?
Absolutely.
As you go, and you need less and less?
Right. So with the dermal fillers, part of what we do is we're stimulating the collagen with a needle. The positive aspect is that is what's stimulating the collagen under there. And your own collagen that gets stimulated after a treatment lasts 3 to 5 years. So to go back to baseline, it's going to take you a really long time just because you've stimulated your own collagen in there.
As far as, smile at your normal expression, is that going to change at all? Or?
No. We don't actually inject any of the muscles that you use to smile with the neuromodulators. You should have the same smile that you had before. I know that's a personal thing for people. Oftentimes patients will say, I don't want any expression in here. They don't want to have to frown. But I do want it up here. I do want to be able to raise my eyebrows, and of course we're always going to want to smile. We're never going to take that away. But then there's some patients that want to have some movement in here just so they can feel like they can be intense when they want to. And so that's a discussion we have, and you let me know what you're looking for. And sometimes the question comes up, is the product movable? And the dermal fillers that we put in, they're hyaluronic acid, they're naturally occurring in your body, and they are very malleable. Typically we like it to be completed by the time you leave. We do all of our sort of molding and sculpting before you go. But occasionally, if you feel like an area is too full, or there's maybe a lump or bump, we can have you come back and we can do some pressure massage to sort of blend that out a little bit. We also have a really great product that is an enzyme that actually eats up the hyaluronic acid. It's like a little Pac-Man, and it just goes and finds the hyaluronic acid. If for some reason you don't like the outcome, or it's too much, which I don't think it will be because of the quantity and what you need. But if for some reason, it's just nice to know that there's that remedy in your back pocket if you need it. So that's helpful, is that it is reversible. As women, we're sort of familiar with maintenance things. We get our hair dyed and we get our nails done. Those types of things are recurring expenses. So it's a little bit easier for us as women to swallow the fact that Botox needs to be done every 3 to 4 months. But just like everything in life, there is a little bit of a maintenance and an upkeep with beauty. The good news is if you can keep on task and get it every 3 to 4 months, you're doing a lot of retraining for your body. Over time, you can stretch that now about 6 to 8 months. And some of my patients only come back once a year for Botox because they've been getting it so long. One thing we need to address is your skincare. So what we have our patients start on their medical skincare, and then when they get to a point of plateau, which I'm assuming you are since you've been on it for a while, we want to kick it up a notch with a product called the Dermal Roller. So what this does is like an aerator for your lawn, or a meat tenderizer. It doesn't bleed or cause any holes or anything like that. It gives micro punctures, so it basically helps the products to penetrate the skin. So we have this sort of the shell on top of our skin. When we put our products in, you can absorb some of them, but only about 10%. And so you're kind of wasting like a lot of those expensive products. When you use this, you're absorbing about 80%. And I recommend that if you're going to spend the money on medical skincare, you might as well throw in one of these, which isn't expensive, and they last about 9 months to a year, to help those products actually work better and penetrate better. One of the things we can do later, if you still want some texture changes, and we noticed from your pictures that you did have some textural problems, we can use one of these that has a little bit longer needles, and we roll it over your face pretty aggressively in the office, and that actually stimulates your collagen. It creates a micro injury. Your body responds to that injury, sending collagen, elastin, and fibrogen, those are all great things. We want as much of those things as possible. And so sometimes we lack in our production of those, and you need some sort of stimulant to produce those 3 things. You can see it's not uncomfortable. You just do this for 1 or 2 minutes, a couple nights a week before you put your active products on, and that really gives you a benefit of absorbing more of those products. Another product I'm definitely going to recommend for you, because based on your skin scan, you had a lot of facial flushing, which was the redness, and vitamin C helps with that. It's an anti-inflammatory, so it helps actually cut that red a lot, and you should be on it anyway, just as an anti-aging preventative for sun damage. But it really helps for those of us, and I'm one of them included, that get a little bit ruddy and kind of flushed. Okay, well, if you don't have any other questions, we're going to go ahead and get started. I think you've been numbing. We're going to start with the areas that concern you the most, and we'll move on to those other areas if you feel like you want to add those extra syringes. And I'll give you a price as we go along. Okay, if we do your temples, it's going to be an extra, $500, or, and I'll kind of price it out that way so that you can make that decision at the time. All right, so that'll be helpful because you'll be on board, and it's more of a team effort that way anyway. And you get to see it going along. You'll get to see how it looks as we progress and as we go.